From allergy problems to tonsillitis, otolaryngologists, or more commonly known as ENT specialists, help treat problems of the ears, nose, and throat. Here to shed some light into those conditions and what can be done to help is Dr. Paul Young. Thank you so much for being here.
It's good to be here.
I'm excited to talk to you about what an ENT does and who you treat. We'll start there and then we'll talk about the procedure that you're able to do.
So ENT physicians really treat comprehensively the conditions that affect the ears, the nose, and the throat, from children to adults, and they treat them both medically and surgically in those areas.
When should somebody see an ENT versus trying a lot of different medications?
So primarily you see a primary care physician, a family doctor, or an internist, and if they determine that when they've reached the limits of what they do, then they would refer you to a specialist.
So this time of year, it feels like everybody's dealing with some kind of a sinus issue or sinusitis. What are the conventional treatments?
So traditionally there's medical treatments and surgical treatments. The medical treatments are vast and include antibiotics and those kind of things. When they don't work, we move up into surgical treatments.
You've got a very non-invasive treatment that you do called balloon sinus dilation that everyone's talking about.
I do it under local anesthesia in the office with the patient fully awake and fully comfortable throughout the procedure.
So tell me about what the surgery is or the procedure.
So the sinuses in our face, they have openings that are drainage pathways. And if they're narrowed or are not working properly, we want to open those up. So traditionally, you would go to the operating room and those openings would be opened up with surgical tools. In the office, I can do it with a dilation balloon that goes into the natural opening, opens up and dilates the natural openings.
The natural opening of our sinuses, is it sometimes that they're just smaller than they should be and we just need to open them?
Absolutely. There's multiple conditions that can make them smaller, whether it be allergy, whether it be the natural way that they formed, or whether there's other cells around there that are kind of narrowing the natural drainage pathways.
And so I would imagine coming to see you, you would be the one to decide this and whether this procedure would be right for. Is it done in children and adults?
So in children it is done, and more under anesthesia in the hospital in children, but in adults we definitely can do it in the office very comfortably under local anesthesia.
After you do a procedure like that, how soon after? Because somebody who has sinus issues, it's always with them. It's like almost like pain. So how soon after do they see that kind of relief?
So there's a variability, but I can tell you there are patients that instantaneously feel the relief.
Wow.
Just the most recent procedure that I did in my office, the patient stood up from the chair and went, wow, I can breathe and I can smell.
And so I would imagine it's like a major game changer to have this type of a procedure done.
Absolutely, especially as they can go back to work the next day.
With somebody who's got a lot of different sinus issues, if medicines, antibiotics, if that's not working anymore, should they make an appointment to see you as an ENT?
Absolutely, we'd be happy to see them.
Why is it that, I feel like in Western New York we have more ear, nose, throat problems than other areas. Is it because of the differences in temperature and climate change?
Certainly when the seasons change and the certain allergens that we have in Western New York do predispose people to more sinus issues. Certainly we get more upper respiratory colds and such, which predispose to sinus issues.
Well, I love the English accent mixed with the Buffalo accent. It's a nice combination. Thanks for stopping by today.
Thank you.
All right, Paul R. Young, MD, located at 4955 Bailey Avenue in Amherst, where they're equipped to take care of all your ENT needs, including allergies and sinus problems, hearing loss, tonsils and adenoids and ear tubes, just to name a few. If you're interested in learning more about balloon sinus dilation and other ear, nose, and throat concerns, give the knowledgeable staff at his office a call at 832-8500, or you can check out their website, paulyoungmd.com.